Hi Joanne, welcome. I am Dr. Trisha. Kamusta ka ngayon? How are you feeling? Kinakabahan ka ba? Kasi you look a little tense eh. Parang ayaw mong tumingin sa mata ko, doon ka nakatingin, tapos ayaw mo ibuka yung bibig mo. How are you feeling?
Honestly, kinakabahan po. Hindi ko ma-articulate yung gusto kong sabihin pero gusto ko lang maging honest on how I feel. Especially on my personal problems din kasi kaya din naman ako nandito. So, pansin mo medyo nanginginig yung boses ko.
Okay, sige. Before tayo magsimula, I'd like to assure you lang muna, no? So, alam ko na you feel takot, you feel tense, but you keep in mind that, again, this is a safe space and I would like you to be as open as you can be. Kasi that's the only way I can understand yung impact ng problema sa buhay mo as a whole. And at the same time, that's also going to be a part of our considerations when it comes to doing the treatment planning para sa'yo. Kasi the treatments that we do, they are personalized. Hindi yan one size fits all. So please be as open as you can. And I want you to tell me honestly kung ano yung naging impact nito. At the same time, yung lifestyle mo, I will be going through a series of questions para din ma-direct tayo kung ano yung magiging treatment program natin for you.
Okay po.
Okay? So, dito sa chart mo, sabi kanina, you've been suffering from bad breath for 15 years na. Okay, so how can you say na, okay, 15 years ko na tong dala-dala. What happened 15 years ago? Paano mo nasabi, oops, 15 years ago, nag-start, nagka-bad breath ako. Paano yun?
Yung first few years, medyo in-ignore ko lang siya. But later on, regular naman yung toothbrushing ko, regular naman ako but that's on my personal lang. Pero I didn't notice that actually may mga feedback akong nare-receive, especially my friends, kapag nasa small area kami. Napapansin ko parang umiiwas sila konti, hindi sila nagsasalita or they cut off the conversation. Pagkausap nila ko, they usually step back and secretly covering their nose. Tapos people can stand to be in the car kapag nakasara yung windows. And to be honest, Doc, lahat sinubukan ko na yung mouthwash, yung nabili ko lang sa online shop na charcoal powder. Tapos kahit sino ng dentist na nilapitan ko, wala pa rin. Lumala lang lalo. Na-notice ko lang siya yung husband ko na mismo, yung sabi na nandidiri siya pagkausap niya ako. Pinakamasakit niya na sinabi is nakakadiri daw ako. That led him to cheat multiple times. So, sobrang sakit, Doc. So, hiniwalayan ko na lang siya. But I have to be strong for my kids. Ang goal ko na lang talaga ngayon is just to rebuild myself. Sana, nasabi ko ng maayos sa'yo, Doc.
Okay ka lang ba?
At least nasabi ko na, Doc. So, at least andyan ka, nakinig ka. I feel validated and supported.
Of course, medyo medyo mabigat yung pinagdadaanan mo because of this condition. So, of course, nobody deserves naman to experience these kinds of struggles just because meron tayong condition. The thing is, it really happens. Nangyayari talaga siya. So, I'm sorry to hear about it. And I'm happy naman that you're telling me na parang nasa rebuilding phase ka. And the most important thing about it kasi is that you recognize and you acknowledge na meron talagang problema. Pero I wanna know, ikaw ba mismo naamoy mo siya? When you do lick test or kapag nagka-cup ka ng ganon?
Kino-cover ko po minsan na nan-notice ko siya, minsan wala. Or baka may problema lang talaga sa ilong ko kaya hindi ko siya maamoy ng maayos.
And then you mentioned earlier, di ba, your friends also are reacting. Di ba? Aside from your husband, meron bang ibang tao sa buhay mo na nagsabi and nag-confirm, uy, medyo,
Wala, binibigyan nila ako ng Christmas gifts na yung oral health packages. Because of that incident, Doc, nabawasan din yung mga friends ko. And sabi ko, may mali ba sa parang hygiene ko? Nagpalit na ako ng mga products ko sa kilikili. Wala pa rin.
So remember, regardless kung saang parte ng katawan, pwedeng kilikili, paa, singit, puwet, batok, o kahit saan man, basta merong bad odor, there is always the involvement of bacteria. Okay? That's why I always tell patients, di ba? Pag nanonood kang commercial, may body odor yung tao, yung model sa commercial, di ba sabihin, oh, maligo ka with Safeguard. Diba? Because it's antibacterial. So, it makes sense. Minsan, kapag desperado tayo, we tend to use a lot of products that we buy over the counter. But we have to remember na, anything that you can buy and you can purchase online or kahit sa, let's say, drugstore, they are cosmetic. Okay? Ibig sabihin, they're meant to mask yung symptom, pero they are not meant to treat. Hindi sila meant to target talaga the cause. Now, if you get to be so dependent on those products, ang tendency is, first, nagde-develop na ng resistance. If it's bacteria, nagde-develop ng resistance yan. Kaya mapansin mo, dati effective tong brand na to pag ginagamit ko. Bakit ngayon hindi na? So, ang gagawin mo, magpapalit ka na naman ng another brand. And you think it's more effective. Diba? Tapos later on, hindi na naman siya nagiging effective. So, nagiging dependent ka to the point na before ka makipag-usap, mumumog ka muna, babrush ka muna, magkikendy ka muna. Which is, hindi siya normal sa buhay ng tao. Actually, we're not supposed to be very dependent on products like that. Do you believe na ito yung reason bakit nag-cheat yung husband mo?
Indirectly, yes. Umiiwas siya kapag alam niya na kung saan papunta yung lips ko pag kahit gabi na, umiiwas tapos natutulog na lang siya sa ilalim ng kama.
Sa ilalim ng kama?
Kasi mas okay daw yung baho ng kama kaysa sa baho ng bibig ko.
Medyo masakit magsalita si Sir.
Imagine 15 years kanya, no, sabihin yung
Gano'ng katagal na po kayong kasal?
20 years po. Na-miss ko siya. But I have to be strong for my kids.
Tama yun. May motivation ka pa. So, again, it's important na nire-recognize mo na merong problema kasi you cannot solve something na hindi mo in-identify hindi mo nire-recognize and you don't acknowledge. So, itong halitosis na tinatawag natin or bad breath, I want you to understand na hindi yan sakit. Okay? It's not a disease. This is what I tell everybody. Hindi siya sakit, so you don't think of it as, uy, meron ako nito, kawawa naman ako. Kasi for some people, parang sinintensyahan na nila yung sarili nila Parang mamamatay na ako, parang sumpa na to. I don't like you to think that, sakit siya. It is a condition. Okay? And it's a condition and a manifestation na merong underlying problem. Okay? So, it can be a systemic problem kung hindi siya nanggagaling sa bibig, but it can also be just in the mouth, which is like 85 to 90% of the time, intraoral siya. Now, minsan kasi, pag nagkakaroon tayo ng ganyan, ng mabahong hininga, parang common yan nag-toothbrush naman ako, pero mabaho pa din. And then you think, and other people would tell you na, galing sa tiyan. Diba? Galing daw sa tiyan, which is hindi siya ganong kadalas. Most of the time, it's just in the mouth. So, we need to check. Pwedeng wala kang cavity, but baka meron kang problem with your gums. Pwedeng meron kang allergy. Pwedeng may postnasal drip ka. Pwedeng may tonsil stones ka. Pwedeng you have dry mouth, which is very, very contributory din siya sa pagkakaroon ng mouth odor. I understand the desperation kasi when you don't understand something, your tendency is to look for solutions online. Lahat na nakita mong ginamit na iba na effective sa kanila, akala mo effective din sa'yo. But the thing is, when you don't understand something and you keep on providing solutions to it, minsan, imbes na makatulong, lalong nakakasama. So, para maging malinaw and maging systematic and scientific yung ating treatment, we have to know all the details first, do clinical assessments, and then provide you with the treatment program. But you have to remember, it's not an overnight treatment, Hindi yan instant. Kasi if you have it for a long time, like 15 years, hindi naman yan magically mawawala siya just by doing one session. Remember also that it's going to be a two-way. Okay? It's a two-way relationship. Ibig sabihin, tutulungan mo din ako. If I give you instructions, you have to follow, you have to be compliant. When you have your follow-ups, you have to be compliant also. But if there's one thing I want to tell you, it's manageable. Okay, it's treatable. We just need to know what it is and what's the cause.
Thank you, Doc. I feel supported. Sobrang sarap sa feeling pala na hindi lang, dapat pala ikaw yung una kong nilapitan, Doc. Kasi sobrang thankful ako sa'yo. You're there to listen. And iniwan man ako ng husband ko. Iniiwasan man ako. Ang importante ngayon, buo pa rin ako. At habang buo pa rin po ako, lalaban po ako.
I love that. Lalaban tayo ng dire-diretso.
Yes po.
Okay.
Lawalik po ako kahit hindi na po ako balik.
Ayan, nakakangiti-ngiti ka na. Okay, let's do your assessment and all the tests.
Siklit po, Faya.
Okay. Okay, upon assessment, we came up with a diagnosis of generalized stage 3 grade B periodontitis. So, meron po siyang sakit sa gums na nagkukos ng pagkakaroon ng odor sa mouth. So, hindi nararamdaman ni Joanne yung problema, yung pain, because technically, when you have periodontitis, hindi talaga siya masakit. So, normally, nagbi-bleed yung gums when you're brushing. Merong mga ngipin tayong nakita na umuuga na or gumagalaw na akala niya okay lang kasi actually, kakapanganak lang ni ma'am. Si Joanne ay masipag naman siya mag-toothbrush, but of course, when we are talking about periodontitis kasi malalim na yung naaabot niyan, may mga pockets na. So, bakit mabaho? Because yung mga bacteria na actually odor-causing, they are anaerobic. Most of them are anaerobic in nature. Ibig sabihin po, they don't like oxygen. So, they hide doon sa mga areas na hindi accessible for brushing and yung normal routine natin. So, ngayon, nagtatago yung bacteria doon sa mga pockets, kaya hindi nare-reach. So, lumalala yung problema, and at the same time, yung odor hindi nawawala. Periodontitis, it always starts with gingivitis. So, kung nakaka-experience kayo ng pagdurugo ng ngipin, kapag ka nagtutoothbrush kayo or nagfo-floss kayo, it's not normal. So, that's an initial sign of gingivitis. Make sure that you get checked and it has to be addressed at that level kasi reversible pa yan. Now, when it proceeds to periodontitis, hindi na siya reversible and mas mahirap na po siyang i-treat. So, if you're seeing these signs, make sure that you see a periodontist. Kung hindi naagapan and hindi natin na-address yung problema, later on, pwedeng nauubos na yung ngipin niya, hindi niya pa rin alam, hindi niya pa rin naiintindihan. Hindi niya alam na meron siya noon kasi, again, technically, walang pain associated kasi doon sa kanyang problema. Kapag hindi na-address, susceptible yung patient to more serious problems. Predisposed siya to having diabetes kasi they have bidirectional relationship. There are also other systemic conditions. Pwedeng magkaroon ng infection sa heart or endocarditis kapag hindi rin natitreat yung infection natin sa bibig. Marami pa. Pwedeng yung kidney, pwedeng yung atay natin or any organ of the body, pwede pong magkaroon ng effect. But of course, the most common would be your diabetes, rheumatoid arthritis, and endocarditis. So, hindi lang bibig yung problema natin. We are actually speaking about yung general or yung systemic health natin because lahat yan ay magkakarugtong. It's also essential that you understand it kasi actually meron ding may genetic predisposition din. So, pwedeng yung magulang or yung kamag-anak ni Joanne, nung pasyente natin, meron nun, hindi lang siya na-diagnose. So, the importance is kung merong anak si Joanne or kung meron kayo nun, yung possibility or susceptibility ng inyong mga anak, pwedeng nandun din po yung risk na magkaroon din sila ng periodontitis in the future. So, since you know already na possible yon at ang early sign nun ay gingivitis, So, make it a habit na magpa-check and wag ipagsawalang bahala if you have bleeding gums. And of course, kung nakakita na kayo ng plaque and tartar doon sa mga ngipin ninyo. So, dun sa treatment natin, since hindi naman siya classic na basta bad breath lang and we were able to identify na may periodontitis or periodontal disease yung pasyente natin, of course, our treatment will be directed towards treating the periodontal disease. So, she would be expecting an improvement doon sa odor, definitely. And bukod doon, yung susceptibility niya to other problems, systemic problems, malelesen din natin.
Doc, thank you so much for listening. And I feel validated. Akala ko lang kasi na hindi ako magigets ng mga tao nakapalibot sa akin ni husband. And you were the first person to define it to me clearly. Naintindihan mo yung case ko, alam ko nakakahiya siya, and you make me feel that I'm really in a safe space. Sobrang determined ako, iniwan man ako ngayon, sobrang nabigyan mo ako ng hope that I could rebuild myself, not just for myself, but for my children, and maayos ko yung lifestyle ko din kung meron ka man ding nakita na kailangan ko ding ayusin sa akin. So thank you so much.
You're welcome. Masaya ako kasi parang kanina malungkot ka nung nag-start tayo. Pero ngayon, medyo nakakadireksyon na, no? Medyo magaan na siya sa pakiramdam. So again, naintindihan ko siya kasi when I was doing it, yung mga first few times, I was trying to be very objective sa pag-treat ng mga cases. But when I started listening to stories, that's when the mission actually happens. Parang, ay, may calling ata ako from the Lord na makinig and to provide help para sa mga taong ganyan. So, I'm doing this actually so that we can have an open discussion and conversation about this kasi walang kahit sino naman ang deserve yung mga pinagdaanan mo just because you have bad breath, diba? Okay, again, to remind you, it's a two-way treatment. Okay, may relationship yan. So, if I tell you to follow the instructions, the prescription, you have to be strict in following. Yung compliance is very important. So, yung program na diniscuss natin kanina, it's going to run for around 6 to 9 months. Babalik ka sa akin mga every 3 months. Okay, at an average. I would like you to help yourself by trying to do things na takot kang gawin. Okay, for example, sabi mo kanina, ayoko na makipag-usap sa iba, yung self-esteem mo, ganito na, because the fear is actually bigger than the reality already, di ba? But, remind yourself, may ginagawa na ako nga wala na aamoy, ganyan, so, try mo. Little by little. Of course, I'm not gonna tell you naman na, labas ka na kaagad with your friends. Hingahan mo sila. Hindi naman ganon. But, do the little things na takot kang gawin. Kasi from there, lalaki at lalaki na yan. Hanggang wala nang dependence on the product. Hanggang kaya mo na and then you see na, easy lang pala to. It's not worth wasting my life just because I have it. Tsaka isipin mo lagi, at one point in our lives, lahat tayo nagkaka-bad breath. Wala namang gumising na mabango yung hininga. 'Di ba? Lahat tayo meron because everybody has bacteria sa bibig. Okay, yung iba may sakit, yung iba may medication na nagpapadry nung bibig nila. So you're not alone. Okay, that's one. You're not alone. It's just that hindi na pag-uusapan. Okay, and normally you feel dismissed kapag ino-open up mo siya sa iba. Because for some, it can be petty. Okay, but the good thing naman about you is, alam mo siya, you recognize it. Kasi maraming tao may bad breath, di nila alam. 'Di ba? So, the fact that you know it, alam mo, mayroong direction yung problema. Okay, yung solusyon ng problema mo. So, I hope you feel better.
Thank you so much, Doc.
You're welcome. And see you on your next appointment. Okay?